Welcome back. October is Breast Cancer Awareness Month. Health experts say most women should begin testing for breast cancer by the time they are 45. But asking your health provider when you should start is encouraged. At the St. Luke's Breast Cancer Detection Center, they provide mammogram screenings and education in order to identify cancer at its earliest, most treatable stage. And joining us now is Jessica Herr, a nurse practitioner at St. Luke's High-Risk Breast Clinic. And Jessica, first of all, thank you so much for joining us here today.
Thank you for having me.
So talk a little about your background for us, for folks who might be watching right now.
So I specialize in breast cancer prevention and risk reduction. About 4 years ago, I started working to develop what is now the High-Risk Breast Clinic to identify women who are at high risk for breast cancer.
So I think everyone's watching this right now, and the question on everyone's mind is, how can you tell if you have breast cancer?
Well, the most important thing is mammograms. I mean, a lot of times mammograms can identify early breast cancers that we can't feel or see yet. So it's important that women get their mammograms because the key with breast cancer is early detection.
You know, we often hear about mammogram screenings. For folks who might not be familiar, I mean, what is that?
Mammograms are breast imaging that is we use that's very detailed, and it's become a long way. We now have 3D imaging that is a little bit more sensitive and able to identify breast cancers on imaging by radiologists who are specially trained to read mammograms and identify breast cancers, because they don't always show up as masses, they show up as other asymmetries or calcifications. So it's important that you have the imaging of a breast, because our hands and our eyes can see and feel, but with the images we can see through what is limited by our hands and our eyes.
Yeah, technology, right?
Yes, yes.
It's very helpful. What are some of the resources that St. Luke's has? Can you talk a little bit about that?
So St. Luke's has resources in that we have 8 screening sites. We also have diagnostic imaging at 3 sites. We also have a mobile mammogram bus that goes around to the rural areas, into businesses, so people who have difficulty getting into our screening sites, we have a mobile mammogram bus that will go to them, and or have trouble getting out of work, they go to some businesses and they can step out during their lunch break and get a mammogram.
That's very convenient, right?
Yes,
it just kind of travels across the state.
Yeah.
Are there barriers that prevent people from maybe getting early detection screenings? I mean, we talked about how that's so important. Yeah,
so some of the barriers could be travel and location. So the mobile mammogram helps with that, but the other is financial. At St. Luke's, we do have programs where we can help with funding for these screenings, so that shouldn't hopefully limit women on getting their screening due to finances. On average, St. Luke's helps about 50 women a month get mammograms and breast imaging at little to or no cost.
What about prevention? I mean, I think a lot of people are wondering, well, how can I prevent this, Yes.
So lifestyle, there's a lot of things like non-modifiable factors such as family history, if you have a genetic mutation, that are we can't modify. But the modifiable factors are lifestyle, such as maintaining a healthy body weight. Having extra weight, being obese, does increase risk for breast cancer. Diet in heavy and red meats and processed foods can raise breast cancer risk. And long-term use of hormone replacement therapy, postmenopausally for long-term, can raise breast cancer risk. So modifiable, that we can do every day is, diet, healthy diet, exercise, and be your own advocate and get your screening, get your mammograms, know your breasts, know your lumps and bumps. So if there is a new lump or bump that shows up, if you see an inverted nipple, if you see skin changes on your breast, such as redness, flakiness, you have pain in your breast that doesn't go away, those are signs that you need to seek out help from your doctor or healthcare provider and get imaging.
Yeah, a lot of good information there. Thank you so much, Jessica Herr with St. Luke's, for joining us here on the News at 4 today. And this will also be on our website at ktvb.com as well. Thank you.